Hello, everyone. I'd like to thank you for joining us today, and I'd like to introduce Greg Jacob from Henry Ford Macomb Hospital, who has helped us bring this talk to the Senior Center.
Thanks, Jennifer. Yes, as Jennifer said, we've been working with the Sterling Heights Senior Center for many years to do educational programs with our doctors and our healthcare providers. So we want to thank you for asking us to bring this very important vaccine information to you today. And we hope you find it helpful, and we hope it keeps you and your loved ones healthy. So with that, I will introduce our speaker. Let me get his bio up here. Our speaker is Dr. Christopher O'Connell. He has received his Bachelor of Science degree in Biological Sciences from Wayne State University in Detroit, Michigan. And in 1995, he graduated from Michigan State University College of Osteopathic Medicine in 1999 and completed his internship and residency at McLaren Macomb Hospital in Mount Clemens. He earned his Master of Arts degree in Health Professions, Education and Administration from Michigan State University in 2014 and became a certified physician executive through the American Association of Physician Leadership in 2016. He currently serves as the Chief Quality and Community Service Officer and Division Chief of Ambulatory Medicine at Henry Ford Macomb Hospital in Clinton Township. He is a clinical assistant professor at Michigan State University College of Osteopathic Medicine and member of the Board of Directors for Macomb County Community Mental Health. So with that, I will turn it over to Dr. O'Connell.
Thanks for the intro, Greg.
You're welcome.
Boy, I'm pretty busy.
Yeah.
I should say so myself. Let me get my screen up here. Okay, you see that okay?
Yes.
All right, excellent. Well, good afternoon, everyone. So COVID-19 has certainly disrupted our lives. And I'm sure you're thinking, Dr. O'Connell, tell us something we don't know. And I don't say that to be funny or to make light of it, but the fact of the matter is this pandemic has been exhausting. And this virus has been relentless. Just about the time when things start to calm down a little bit, we're hit with another wave and we see the numbers go up and we see the hospitalizations increase. And with the state opening up more and more, you might think that we're okay, but the fact of the matter is we cannot let our guard down. And why, you ask? Well, the numbers are going up in Michigan, if you've seen the latest news, and particularly hospitalizations of unvaccinated adults have also gone up. And I can tell you from our health system standpoint, our operational unit here in Macomb County has seen the largest increase in number of hospitalizations. So we're certainly not out of the woods, and we need to continue to be vigilant. And this pandemic has isolated us from our family and our loved ones and has made us feel helpless at times. So what I'd like to talk to you today about is one of the tools that we have to help us battle this nasty virus, and that's vaccines. So I hope you can take away 3 important points from my discussion today. The first point is that COVID-19 hospitalizations are increasing among unvaccinated adults, particularly those that are in the younger adult age groups. The second point is that the vaccines that we have available to us are safe, have relatively mild side effects, and have proven to be effective in clinical trials. And lastly, which I'm sure you realize this, but we must continue to be vigilant in protecting ourselves and our loved ones by all means possible, and using whatever we can to prevent the spread of this virus. So please keep those 3 important points in mind as we go through this talk.
Dr. O'Connell, let me interrupt you for a minute. Your slides, see if you can make your slide larger, because we're seeing the title slide large, but your content slide is small.
Okay. I haven't advanced them yet though, Greg.
Oh, there you go. Okay, that's
Okay.
better.
Here we
Is
go.
there any
So
way you can you make it even bigger?
let's see if I can increase this a bit.
Zoom into the slide.
I don't want to zoom inside.
No. Just we tried display settings up at the top.
Oh, it'll give two different slideshows.
Oh, wait, try that again. Go back up there again. Swap presenter view and slideshow. Yeah, there you go. That's
Good?
better.
Okay,
Yep.
sorry about that, folks.
That's right. Sorry to interrupt you.
No problem. Okay. So let's get into the meat of the discussion here. So my first point was that COVID hospitalizations are increasing at an alarming rate for unvaccinated adults. So what do you think of these statistics? Hospitalizations increased 800% for adults ages 40 to 49. And for adults ages 30 to 39, that number of increase is 633%. And this is between March 1st and March 23rd. I mean, these are staggering numbers. So again, we must continue, regardless of your age, be vigilant about keeping our guard up. Even though things are starting to open and people are doing more and more, we still need to protect ourselves. Fact number 2 is we do have vaccines available to us. At the time of this talk, we have 3 vaccines available to us. And I'm sure you've either heard of them or read about it. But these vaccines are safe. They have relatively mild or minimal side effects, and sometimes no side effects, depending on the person receiving it. And they provide protection against severe illness. People who have underlying health conditions, as we all know and we've all heard, are at increased risk of developing severe illness from being infected with the COVID virus. But as I mentioned, we have 3 vaccines: the Pfizer vaccine, the Moderna vaccine, and just recently Johnson & Johnson vaccine that are all been approved by the Food and Drug Administration after rigorous clinical trials to be used in vaccinating against the COVID-19 virus. I can assure you that no corners were cut in the development of these vaccines. There's been a lot of concern because these came out relatively quickly in the grand scheme of things. However, the same amount of rigor and the same amount of scrutiny were used to make sure that these were safe for use and that they were even effective in treating or preventing the virus infection. Now, the Pfizer and the Moderna vaccines require 2 injections. The difference with the Johnson & Johnson vaccine is a single dose injection. But again, each of these different types of vaccines have been proven to be safe and effective. So as I mentioned, my third fact was that protecting ourselves and our loved ones against this virus is essential. So what can we do? And I think everyone knows what we can do because we've been doing it for the better part of a year, heading into our 2nd year of this. Continue to wear a mask. Continue to wash your hands. Avoid large crowds. And then when we are with people, to social distance as much as possible. And when the vaccine becomes available to you, either through a health system, the county, or your local pharmacy or food store, consider getting the vaccine to protect yourself and your family. So let's dig a little deeper into the safety profile of these vaccines. Now, the vaccines, as I mentioned, and I've said over and over again, have been proven to be safe. The data surrounding the studies in the development of these vaccines have been carefully reviewed by a number of different federal agencies. The Food and Drug Administration is one of them. The CDC is another. And they've all been determined to be safe for use and have been granted what's called emergency use authorization. I can tell you from a health system perspective, we have experts within the system that have also reviewed this data just to make sure that they feel that it's safe, and they have agreed that these are safe to be used. And we've vaccinated many of our employees and providers throughout the health system. And again, no corners were cut in the development of these vaccines. I have a slide up now that kind of compares the three vaccines. They differ a bit in their percentage of effectiveness. Of course, we mentioned that they vary in the number of doses that are required to receive that maximal effectiveness. There's some differences in whether or not they need to be diluted and how they're stored. But the key point is, if you look, the Moderna, 94.1% effective after both doses. Pfizer, 95% effective after both doses. And the Johnson & Johnson, in the United States study, showed that it was 72% effective, but then 85.4% effective in preventing serious or critical disease from the virus. That's an important point. On the first wave, we saw many, many hospitalizations and many, many people requiring care in the ICU units. So what we're trying to prevent is that recurrence and that number of people requiring hospitalizations. All three were carefully scrutinized in clinical trials. What's important to know about these vaccines is that they cannot cause the COVID virus. Let me repeat that, it's worth repeating. Getting the vaccine cannot cause you to get COVID-19. Why? Because they don't contain any viral particles or infectious agents that can cause an infection. There's no live vaccine, there's no live viruses in the vaccines. The technology that was used to develop these immunizations has been around for many, many years. It's been studied extensively. It's actually been used to create other vaccines that we get and that we've had for quite a while. So there's special populations that need to be considered about who can and cannot receive the vaccine. As we mentioned at the very beginning of the presentation, individuals who have underlying conditions, underlying health conditions, like diabetes and heart disease or cancers, those individuals are at increased risk of contracting the virus and becoming ill. So they definitely should consider having the vaccine. There's been questions about whether it's safe in women who are pregnant. And the answer is that the data, although is insufficient about it, we do know that pregnant women are at increased risk of developing the COVID virus or infection from the COVID virus. So they are a group that really needs to be protected. So pregnant women should really discuss this with their OBGYN specialist and determine if it's the right decision for them. So what about immunocompromised individuals? Well, the thing about individuals who are immunocompromised is they may not develop a strong response to the vaccine. Your body's immune system needs to be fully functioning to really get a full response. So there isn't a chance that a person who is immunocompromised may not develop that full response. However, because there's no live virus in the vaccine, it will not cause infection in people whose immune system is suppressed. Then there's the concern about patients who have autoimmune disease. Well, it's been shown that receiving the vaccine does not cause a flare-up of any of these autoimmune diseases. So it's safe to use in them as well. The discussion of side effects has come up quite a bit, anecdotally, probably among your friends and family, and certainly on the media. So there are side effects to the vaccine that some people have experienced, not all people. And they may occur anywhere from 1 to 3 days after receiving a dose. It seems to be more significant after the second dose of the Pfizer and the Moderna vaccines. And in reviewing the data, it seems to occur more often in younger individuals for whatever reason. But the fact of the matter is that only about 2% of people feel ill enough to really have to limit their activities. And I'll tell you what the common side effects that many people or most people that do have side effects experience are fatigue, muscle aches, joint aches, some have a fever, and some complain of a headache. But again, it's not with all patients. I can tell you I personally got both and experienced no side effects whatsoever after 2 doses of the Pfizer vaccine. But the single most common side effect is actually protection against the virus, which is a good side effect to get. The other concern that's often discussed is the variants that are being seen. There's a variant from the United Kingdom, from Brazil, and from South Africa. So in order to continue to survive and stay viable, viruses need to change or mutate. And this is what they mean by these variants that come in. Now, what has been seen early on is that these variants seem to spread a little more easy and maybe a little quicker than what we've seen in the first wave. But researchers are still investigating to see if these are any more cause severe illness or are more likely to cause death among patients who contract it. So studies are still occurring with that. There's not a definitive answer as to whether that's the case. But early research has shown that the vaccines that are available do help and do have some effectiveness against these variants. So we continue to learn going into 2 years of this pandemic more and more, not only about the virus and its effects, but about the vaccines that we have and how it helps protect us. So the other thing that we need to talk about is actually the vaccine supply. And the unfortunate thing is that the vaccine supply is limited and the rollout of vaccinations has not been as robust as what we hope it would be. Henry Ford Hospital and the health system as a whole have been prioritizing who we vaccinate based on the guidelines that are set forth by the state of Michigan. And as more vaccines become available, we definitely plan to offer the vaccine to more and more individuals, age groups who qualify and who would like the vaccine. So if you're a Henry Ford patient as we speak and you have an active medical record number, Henry Ford will reach out to you when you become eligible, either by phone, by email, or text, whatever way you indicated to be your preferred method of contact, to let you know that you can make an appointment. And there'll be instructions on how you make that appointment when you are contacted. So I just want to review the 3 main facts that we shared in this webinar today. Again, despite our best efforts, the COVID hospitalizations are increasing, especially for unvaccinated adults, and it seems to be hitting the adults in the younger age group. So what this means is, despite the fact that things are opening up around us, we need to remain vigilant. We need to continue to do what we do to protect ourselves and our families against the virus. The other takeaway point, again, is that these vaccines that are available are safe. They have side effects, but not everyone experiences them. And for many of the people who receive the vaccines, they are minimal or mild. And they do provide good protection against severe illness caused by the COVID-19 virus. To review, there's 3 available: Pfizer, Moderna, and Johnson & Johnson. And again, all have been carefully vetted through rigorous clinical trials and have been deemed safe and effective by a number of agencies. No corners were cut to make these viruses. And again, what's important to understand is that there are some differences in these, but which one to choose is often a question. And the answer is whichever one you can get first. So whatever becomes available to you first, that's the one that you should get, because they all protect you against serious illness. And finally, we need to continue to protect ourselves and our loved ones. This is essential. So until the time when everybody is vaccinated, or we get a large portion of our population vaccinated, we need to continue what we've been doing for the past almost year and a half now. And that's to continuously wash our hands, to wear a mask, to avoid large crowds of people, and when we are in contact with people, to social distance as much as possible. There's a significant amount of information all over the web. You can actually go to our website, www.henryford.com, for more information. You can go to the Macomb County government website to not only have information, to see information about the virus, but also about vaccine locations. And of course, you can always visit the CDC website for a significant amount of information. And I encourage you to talk to your physician whenever you have questions or concerns to decide if it's best for you to get the vaccine. Now, I'm talking to you today not only as a doctor, but I'm also a son, I'm a husband, and I'm a father of 4. And I can tell you that as I mentioned earlier in this conversation, I myself got the vaccine, and both my parents, who have underlying health conditions, got the vaccine. And when the vaccine becomes more readily available and my wife and children are eligible, I will encourage them to get the vaccine as well. So with that, I'll end my formal comments, and I'm happy to answer any questions that I can, or discuss things or clarify things.
I'll start you off with a question if there's no one else that has a question. I don't know if you were on our safety call earlier this week, but someone brought up that the rumor that some people have been getting the coronavirus from the vaccination. Have you seen that? Have you seen any evidence of that?
No, not at all. And again, the way that the vaccines were created was using technology that we've had for many, many years, as I mentioned earlier. And again, there's no viral particles in it. There's no DNA from the viruses that are in these vaccines. What it is a programming, a code that tells our cells to develop antibodies against the virus. And I'm sure many in the audience have seen the picture of what the COVID virus looks like with the spikes. Those spikes are the target of our antibodies to prevent them from attacking our cells. So again, there's nothing in there that's infectious. What many are experiencing in these side effects is actually our body mounting a response, getting ready so that if it is ever exposed to these viruses, that it can fight them off.
Right. And of course, as you said, the vaccinations are 95% effective. So there is a little chance that somebody could, that the COVID could get through it. And to your point, I was on a call with the county just before this seminar, and that question came up, and Andrew Cox, the county health director, said the same thing you just did, that the vaccines are very, very effective, and he's only heard of 5 total cases in the county where the virus had broken through the vaccine. So that's again a very little amount and does not, does not indicate, his point was that it does not indicate that people will get infected even though they take the vaccines, that the vaccines are safe is basically.
That's correct. That's correct. Yeah, they're not 100%. There's no 100% guarantee that you get vaccinated and you will not get the virus. But, the 5% of the time, you could still become infected even despite getting the vaccine. So just need to keep that in mind. But I'll be honest with you, 95% are good odds for me. So I would take that chance to take the vaccine and have a 95% chance of not developing serious illness.
Yeah, that's a good way to put it. It's the risk of getting COVID is greater than it's more risky to not get the vaccine.
Yeah, when we have things that are upwards of 90% or even the 80% effective, you're better off protecting yourself and taking that chance and betting on a way to prevent it.
Right. Any other questions out there? If not, I've got another one.
Okay.
I heard on the media today and yesterday that we are getting from the state of Michigan is getting a new huge supply of vaccines. So they should become more available, I assume, soon. And maybe go over again what you said in your presentation about the availability of the vaccines from Henry Ford and elsewhere.
Right. So Henry Ford is following the state of Michigan guidelines for who becomes eligible. And as the supply increases and we have more and more available to us, we'll start spreading that out more and more. So we've of course vaccinated our staff because they are in constant contact with patients. And what we want to do is protect them so they're not spreading it to other patients. So that was our first approach. We're extending it out to individuals who have the underlying condition, who are older, because they were the ones that were really significantly impacted with that first wave. And then as time goes on and we're getting to more and more people, we're starting to offer it more and more. For those patients who are already patients at Henry Ford and they have an active medical record number, they will be contacted by Henry Ford at some point by their preferred form of contact to tell them when they become eligible. And I can tell you, one of my colleagues told me that someone in their family just got contacted. So I know that that's happening, and hopefully it's happening consistently across the board. But when they receive the information that they are eligible, they'll also receive instructions on how to schedule the appointment, and then they can get that. Now, I would direct anyone who is not a patient in our health system to check the Macomb County website, because they do have a lot of lists on there that tell you where you could potentially get it elsewhere, be it through the county itself, or like I mentioned, some pharmacies may have it available, or some of the local grocery stores that have pharmacies within them, they may have it as well. So check and see what's available, see if you are eligible. And I even know of ability to schedule online through your phone app for some of the pharmacies in the area as well.
And of course, one of those sites that's available through the county, I think the county has 9 sites altogether. One of them is the Sterling Heights Senior Center there on Dodge Park.
Exactly.
And I put the website, the county's website, in the chat box, and I put the Henry Ford website, and I put the CDC website in. So those were the links that were on Dr. O'Connell's last slide for more information. So they are in the chat box for anybody that wants to copy those or use those for further information. Anyone else? Jennifer, are you still there? Do you want to?
I am. I'm sorry. Yes, I am.
That's okay.
It sounds like nobody else has questions, but I think that we are all set, and I'd like to thank Dr. O'Connell for sharing this information. Even though I've had the vaccine, I actually found it very useful for me to share with other people. So
Yeah.
thank you very much.
I've had it too, and again, I would recommend everyone get it. It wasn't bad whatsoever.
Yeah, thanks for the time. I appreciate the opportunity to speak today.